Welcome to Dog Fanatic. I am Penny McKinney, and I am talking today about puppy strangles. And the reason I'm talking about puppy strangles is honestly because I have never heard about it before. And I had met someone who has the Bernese Mountain Dog. I'll speak a little bit about him later. And it was a puppy and completely normal when they got him. And then this popped up. So that's why I want to talk about it. And sometimes people get it mistaken with a bee sting. So I do want to say something about it. Hopefully somebody can hear something, know something. If they see something, they can think about it. Could save a dog's life. So puppy strangles. The people that I have the veterinary clinic that I have gone through is the VCA Animal Hospital. And the picture above, I would like to give credit to Dr. Stephanie Clark from kingdom.com. She is responsible for this picture, and I just want to make sure she gets the proper credit for that. And the VCA Animal Hospitals, I will talk about the people that have written this article specifically, and it was concerning puppy strangles. So anyway, I'd like to move on. Okay, to clear the air, I have heard about puppy strangles. I have heard about strangles, but I had heard about horse strangles. Now, horse strangles is it's banned from horse shows, horse races, horse clinics, barrel racing, Western, English, everything. If you have strangles, your barn gets closed down and it's under veterinary care. It's kind of like a plague because it goes through the horses so quickly and it will kill them. Puppy strangles is not like horse strangles. I want to be clear on that. Puppy strangles is also known as juvenile cellulitis or sterile granulomatosis dermatitis and lymphadenitis. Okay, so pronunciation may not be exact, obviously, because it's all very Latin words. Okay, so juvenile cellulitis is uncommon in dogs. It is a skin disease and can affect pups 6 months of age and up, very rarely, sometimes up to 4 years of age. So this condition is known as being idiopathic. What is idiopathic? Idiopathic means that the cause is unknown. What is going on, what happens is the puppy's own immune system is attacking its own skin. So that's what's going on, and it needs to be diagnosed as quickly as possible. VCA animal hospitals do believe that there may be a link, a hereditary link, and that there are certain breeds to have puppy strangles more commonly, even though it is still rare. And those include golden retrievers, the dachshunds, and the Gordon setters. And the reason I became interested in this subject is because of the new customer that I have met that comes to me, and his dog, he's got a Bernese Mountain Dog, and he was telling me about this puppy strangles. And I was thinking horse strangles, and they have nothing in common with each other. And puppy strangles is not contagious. I do want to be clear on that. It's just something that the puppies get. They're not sure how they get it. And if it's not treated, they won't do well. There is a possibility of dying, and it's not a good death. So the course of treatment is not a difficult thing either. So I had never heard of this at all. So it meant I really think it would be good for me to talk about it and get it out there, and for other people to maybe hear this and think about it. If they ever see a swollen face on a pup, it's not always a bee sting, and it's not other things that do get ruled out when they do check for strangles. They do a skin scraping for that. So what are the symptoms? What are the symptoms? I am referring here to the VCA hospitals and in this article, and this article was written by Dr. Malcolm Weir. He's a doctor of veterinary medicine, and Catherine Barnette, who's also a doctor of veterinary medicine. And their article is titled Juvenile Cellulitis, otherwise known as puppy strangles. So the first symptom is an abrupt swelling of the head, including the snout. So this is why a lot of people associate it with a bee sting. When you see these bee sting pictures on Facebook or whatever, it may not always be a bee sting. The swelling of the head, it includes the snout and the eyes. It includes the whole kind of face, not the back. Well, sometimes it spreads later if it's not taken care of, but hopefully people take their dogs to the vet because it's pretty noticeable, as you can see in the picture. They will break out in lumps and pimples, and some sores explode after a while, and then they scab up. These are called lesions. Severe wounds all over the face, including the eyes, and disfigurement may be permanent if not treated. If not diagnosed and treated, it may cover the entire body of the dog. It has to be treated immediately to prevent this. VCA Hospital states the paws, the anus, and the vulva could also be infected. It has such a sudden appearance, it looks similar to a bee sting. A skin scraping is performed for a diagnosis, and other conditions are ruled out. A biopsy is performed that will prove a certain kind of swelling that will single out puppy strangles, so it can be diagnosed. Puppy strangles is an immune disease, which means that the immune system has to be stopped from the reaction of attacking the skin. Prednisone is commonly used. It is a steroid and it's not expensive, thank God. Sometimes the lesions that have occurred are also treated with antibiotics. In the long run, puppy strangles heal immediately with fast treatment. Usually one course of steroids is all that is needed. If it rebounds, lifelong steroid treatment may be necessary, but that is very rare. So I know this is short and this is brief, but I just really wanted to get this out there because I think of, we see bee stings all the time. And it would be terrible. You can see the lesions on the puppy's face here. If it's treated, it's something that we can take care of quickly. So don't always assume it's a bee sting. Don't assume it's ringworm. Don't assume. Just take your dog to the vet. Ask for skin scraping, possibly a biopsy, and just get it taken care of. All right. Again, this is Penny McKinney, and this is extremely brief. Sorry about that. But I just wanted to get it out there because I had never heard about it. And I think that is amazing. Well, hopefully it's just that rare. Okay. Well, thank you. And you guys have yourself a good day. And if there's anything you ever want me to talk about or bring up, please leave a message in the comments. Thank you. Bye.